and welcome back to our online platform, Pediatrics To-Go. We're delighted to have you here. So we're going to talk about preseptal cellulitis, and that's swelling around the face, right?
No,
The
around the eye.
Okay, thank you. All right, we have the experts here to educate us as usual. So yeah, you have the floor, Dr. Sanusi.
Hi, everyone. So we're talking about preseptal cellulitis because we're seeing a lot of that, especially summertime, people are outside playing. We do have a lot of children coming in and they have swelling of the eyelids. Now, when you have swelling of the eyelids and it's from allergies, there's a history of, your child has been itchy and rubbing the eyes, and sometimes there's clear, watery discharge from both eyes, especially if it's from pollen or dust. But when there's no history and it's usually one-sided, when there's a one-sided eye swelling where your child wakes up and the eye is swollen shut, especially with the upper eyelid or the whole eyelid is swollen and coming out, then we worry because there's something called preseptal cellulitis. Preseptal cellulitis just means that it's the other name for it is periorbital cellulitis. Now the orbit is where the eyeball is. All this place, it's the orbital space. And when we start to have infection on the eyelid, it could have been just your child rubbing the eyes and then an infection of the eyelid. But by the time it's swelling and this part of the eye is all swollen, we have to do a good history, a good exam, make sure that your eye can see. I mean, your child, sorry, make sure that your child can see through that eye. So we shine the light to make sure that there's pupillary light reflex. And we also have your child look in different directions to make sure that there's no paralysis. There's something called preseptal cellulitis, which is there's a septum that this is your eyeball. There's a sling that holds the eye in place. So, and there's a septum, kind of like a demarcation between preseptal. So preseptal is in front, postseptal is behind the eyeball. When there's an infection of the front of the eye, we don't worry too much. But when it spreads into the orbits, where the back of the eye there's infection and the whole thing, it can cause your child's eye to actually, you might end up going blind. So that's why it's extremely important. Your child has eye swelling, they need to be seen. Most times it's usually an infection. They need to be treated with the appropriate antibiotics. So you want to take them to the nearest hospital where there's preferably a pediatrician there so that they can get the correct antibiotics and so that your child will just have that infection and get it cleared up as soon as possible. Because once it's getting into the postseptal area behind the septum, then the children have to be admitted for IV antibiotics to clear that infection, and the ophthalmologist has to be involved to make sure that the vision of that child is preserved, because that's can be a very serious infection. So please, if your child wakes up and one eye is swollen and there's no discharge. Now you have the popular Apollo or conjunctivitis. That will cause yellow discharge from the eye, and that will cause redness. When you open the eye, you see it's all red. But this, usually, the eye is not red and there's no discharge. Maybe there might be a little bit, but once you see swelling that is so significant, especially up here, and the whole eye is swollen, please see your doctor so they can start antibiotics. If they need IV antibiotics and they need to be admitted, and the eye specialist come and see your child, then so be it. But sooner is always better, and the sooner you get it treated. Usually once we start antibiotics on time, within a week, the child is fine, the eye is down, there's no more swelling, no redness, and everybody's happy.
But do they need to check with the ophthalmologist still?
No, if it's just the eyelid that's swollen, they can see very well, they can move their eyes back and forth. They can move the black part of the eye back and forth like that without moving it, and they can see. This is just an infection of the skin around the eyelid. And if there's no visual deficit, they don't need to see an ophthalmologist, but it's good to follow up with the doctor to make sure it's all cleared up. And most times we give antibiotics. Usually clindamycin or cephalexin are the choices of antibiotics, but ask your doctor so you can get the right dose and so that treatment can be started ASAP. And because it's not inside the eye, it's on the outside, they don't need eye drops. Sometimes it can be inside, it can be both, and they need both eye drops and oral antibiotics. But if it's just on the outside and it's swollen and the red part of this part of the eye is not red, or the white part of the eye is not red, then it should be fine.
Okay.
And most children, when they get it, they get treated, they're fine, there's no problem. But I've seen orbital cellulitis, but it's maybe once in 10 years. It's
in
not
Nigeria here, have you seen some cases like that in Nigeria?
No, in America.
So it's not common here.
It's not common. Well, maybe the eye doctors see them, or maybe we just don't see them because they've gone somewhere else. But I've never seen orbital cellulitis in Nigeria, but I've seen it in the US.
All All right, thank you so much. Well, I've learned something today. I hope you have too. So until next time, we'll see you guys later. Bye.
Bye.